Hi, welcome back to the channel. I'm Dr. Scott Peters, and today we're going to show you some video footage of procedures that we do. People oftentimes want to know what they're going to be facing if they have to come in. So if you have an infected or ingrown toenail that has to come out and you've gotten to a point where you know you can't get it out on your own and you need to be seen. So we're going to walk you through the procedure, and I think you'll find it to be a bit comforting. People come in and they're high anxiety, very concerned, very nervous about it. Other people are not, but for the most part, people get very nervous the first time they're having it done. So the following is some video footage of a charming young lady who came in and she had an infected toenail on both sides, both feet, both big toes. And so we'll show you the footage of what it looks like. And I think when we get done, you'll feel much more confident that if you have to have it done, it's not going to be the worst experience you've ever faced. So the first thing we're going to do is we're going to anesthetize you. So we do that with 2 small injections. This is just a little alcohol that we're cleaning off the surface of the skin with. And then we'll use a mixture of lidocaine and marcaine that provides pretty quick anesthesia or a numbness feeling so that you're not going to experience any pain during the procedure. And it also will last probably 2 to 3 hours afterward. Oftentimes, patients not having to look at it is very comforting for them. Here I'm just spraying a very cold spray on there. It doesn't really numb the foot, but sort of confuses the signals to the brain, so you don't know if you're feeling anything sharp or cold. Just going to put 1 cc of anesthesia on one side of the toe and another cc of anesthesia on the opposite side of the toe. And that should provide adequate anesthesia for the procedure. Right now, she's not in any pain. I ask the patient, are you feeling okay? And very rarely do I have anybody that's really in any kind of significant pain. It's a bit uncomfortable. I always tell people, it's not going to hurt, but you're not going to confuse it for a back massage either. So we're just continuing to deposit the anesthesia. And once I've completed infiltrating the anesthesia, so then I just put an antiseptic on the skin to clean off all the surface bacteria. It's a little more potent than the alcohol, and the patient doesn't feel this is insignificant with regards to discomfort. And once it's dry, then we'll begin the procedure. So when we're doing both feet, as soon as I'm finished with anesthetizing the first toe, then I'll anesthetize the second toe, and that's what you see here. And by the time I get back to the first one, it should be numb, and I should be able to continue with the procedure without any delay. So there's not a lot of variation when you're anesthetizing the toe. Most people, I can use 2 cc's with it, and we get perfect anesthesia. Some people it takes a little bit longer than others. If there's a very bad infection, that can provide delayed anesthesia. Interestingly, when people are very nervous, they tend to metabolize the anesthesia quicker, and so the numbness won't last as long. I've actually had a few patients over the years who were so nervous that before I was done with one side, the other side had already lost the anesthesia, and I had to numb them up again. So it's a good idea to try and calm yourself on the way in and just know you're not gonna have a bad experience, and just know with great confidence that it's only a little uncomfortable, but definitely not painful. So next I'll put the antiseptic on the other toe as well. So both sides will be sterilized, so to speak. It's not true sterilization, but the surface bacteria should be eliminated by the time I do the procedure. So before I start the actual procedure, I always test to make sure that we do have anesthesia. And I do that by taking a kind of a sharp tweezers and pinching you on a part of your foot that is not numb, and that's what I'm showing the patient right now. And when I pinch you up there, you say, ouch, that's very sharp. And then when we compare it to the responses, usually I don't feel anything, or I know you're there, but I can't feel any pain. So that's how I know the toe is numb, and then we can proceed. So the first thing I do is I take a very slender instrument that is not sharp. It doesn't have a cutting edge on it, so you couldn't cut your skin with it. And I just tease the skin away from the nail, and I do that on the sides and then go underneath the nail. If a person was not numb, that would be very uncomfortable. In fact, there's been discussions over the years that that's how they've tortured prisoners of war, by sticking things under their fingernails and their toenails. But in this situation, there's no pain. They don't feel anything. And once I've freed all the soft tissue attachments to the nail, then that edge of the nail is ready to be cut. And it's very similar to a regular nail cutter. So at this point, I'm sliding this instrument underneath the nail and freeing up the soft tissue attachments to the nail bed. And once that's completed, I'll use an instrument called an English anvil, and you just kind of slide it underneath the nail. It slides very smoothly. It's not traumatic to the tissue. And then it cuts the nail just like a nail nipper would, a nail clipper would. And then I just go in and make sure that the nail is completely detached all the way back underneath the skin. And when I'm doing the procedure, I can feel it give when the final segment of the nail dislodges from the remainder of the nail. And then I take a hemostat and I just grab onto that piece of nail, and it's very loose at that point, and I just slide it out. And this is just some of the infected tissue that I'm removing. The procedure is, for all intents and purposes, on that side of the toe, it's done. I'll do the same thing on this side. I'll slide this spatula, it's called, underneath that edge of the nail and free it up. And then I'll take the English anvil and make a straight cut back. And now it's freed at what's called the proximal edge. So I should be able to just grab it with a hemostat, and there it is. You see that? So that comes out, and just kind of reevaluate it, make sure there's no other tissue that needs to come out, any devitalized tissue. There's a little wafer of skin there. And look, make sure there's no nail still in there, and there clearly is not. It's easier for me to see when I'm in front of the toe than it is for the camera to pick it up. So now there's nothing left to do but just kind of clean the toe off. So now I'm just putting a gauze sponge on with some antibiotic ointment, and that's the first layer of the dressing. I'll wrap a little conforming gauze around it just to put a little compression on and hold it in place. And then we'll finish it off with a mildly elastic bandage that puts a little compression on it, keeps the swelling down a little bit. This dressing will be removed later in the day, and she'll begin local wound care, which will include soaking in warm water with Epsom salt, and then just applying a bandage with some antibiotic ointment. And that's really the entirety of the procedure. It's a pretty simple procedure. You can see, she didn't jump, she didn't kick, she didn't let out any screams. Now that the first toe is completed, we'll redirect our attention to the opposite foot, and we'll do the other side. And so I'm just testing her to make sure she's numb. She is. If she wasn't, you'd see her foot withdraw pretty quickly. And again, we just replicate the procedure. I'm just freeing the soft tissue attachments to the nail on the tibial border or the inside part of the toe. And then I slide the spatula underneath it and free it up from the underside of the nail. And the English anvil will go ahead and clip that segment of the nail and free it. And with a hemostat, we'll just remove the segment of nail. And here we are doing it on the fibular side or the outside of the nail, and just removing a small segment of the nail. And now the procedure is done. We'll just clean it off a little bit and put another antibiotic and put another gauze sponge with antibiotics on it, and we'll finish it off with a nice looking dressing. So I always buddy splint it to the adjacent toe because it tends to hurt less when the anesthesia wears off. And then the discoloration from the antiseptic that we use, that comes off with soap and water, or even when they soak it in the Epsom salt. So here we have completed the whole procedure. That was me straightening my pants, and I'm just marking with a pen where the end of the tape is so she can unwind the tape instead of ripping it off, because sometimes that dressing will stick a little bit. And then the patient walks out with no pain. They can drive home, they can walk home, and they can do whatever they want. It seems to be a recurring theme in my office that on Thursday afternoon, we get a call from a patient or two that has to be seen. It's an emergency. They have a football game tomorrow, and there's no way they can take the field. And usually they come in and their toe is so swollen that the skin is over the nail. You can't even see the nail. It doesn't look like there's a nail. There's just a giant toe. And they can't imagine playing one more down of football or soccer with that toe like that. And so, the point I'm making is just simply that when we're done with this procedure, they can go play football and they can go play soccer. And so there's really no limitations. I don't like people to go swimming till I see them a week later. But so that's usually my standard protocol is I'll see you in a week after this. We could do it through our virtual clinic, or we could do it live and in person. So it's a pretty benign procedure. Again, just knowing that a doctor is going to be coming at you with a needle in his hand and he's coming after your toe, that's not the most comforting thought. But now that you've seen it, you see that there was almost no reaction from her at all. I don't believe there was any reaction. That's what you can look forward to. I have two goals when I'm anesthetizing you. One is I want the anesthesia to work, and two, I want to do it without causing you any pain. I hope you enjoyed watching this. Again, it's not the most glamorous, but patients who have never gone through this, in their mind, they have images of some kind of barbaric procedure, or somebody has told them that it was the most painful thing that they ever experienced, worse than childbirth. Clearly, that's not the case. If you've been holding off because you've been worried about it, I think now you should have the confidence to just come in and we'll take good care of you, and you don't have to worry about it being a painful experience.